My name is Dr. Mark Jones. I'm a podiatrist and podiatric surgeon. When I was younger, my mother was a nurse, and she actually took me when I was 5 years old to her classes. As a child, you don't know how much that penetrates in, but it did. When I was looking at different medical schools, I did an internship in Florida. The team that took care of the Miami Dolphins had a podiatrist on staff there, and he kind of recruited me, so to speak. I applied to podiatry school after having some experience with another podiatrist and found it to be everything I was looking for. You know, it's unfortunate it happens in our society where people don't have insurance and no one was willing to take this child. And he had a severe flat foot deformity. I was at the time one of the only surgeons in the area that took kids, and I still take children. And at that point, I outlined a surgical protocol to be able to get him to be able to walk. He literally was walking on the inside of his ankle. By the time he was done, he walked out of my clinic happy, parents were happy. Those type of things that really touch you and stay with you for a long, long time. What would be a hobby of mine that would surprise a patient? I do like to read a lot. Not a lot of people know that I've sang in a few weddings. I don't share that with many people, but I do enjoy, hanging out with my son who's a musician and trying to encourage him to let dad be on a couple of his songs or albums. One thing I can't live without, coffee or running. I like to run, I like to be active. If I feel like I'm having a lazy day or not in the best day, I go out and I do a nice long run or spend time on the treadmill when it's cold outside. I like to spend a lot of time on nutrition, health and weight maintenance, things like that, as well as staying active, especially when you get older, when you lose your balance, things like that. So I like to focus on nutrition, exercise. My favorite part about working for NorthShore is the mission statement. I was in private practice for many, many years, downtown Chicago. Fortunate enough, I've been highlighted on WGN TV. I've been in many newspapers. When I came to Northwest Indiana, I was fortunate enough to be the podiatry director at Methodist Hospital. But the mission here is different. The mission here is allowing me to do all of that within a structure that takes care of people who truly need our help. There are a lot of great doctors out there, and there are a lot of locations to go, but when you truly need a system that cares and has a mission statement to help all those in need, despite their ability to pay, that's what I do. At 25 years into practice, that's my goal.